I've been able to see my patients more organically in the house call setting. I mean, I see patients' behaviors that these are the same exact patient. Like, it's not like one cat versus another, one dog versus another. These are patients that I had the experience of seeing how they acted in the clinic, how they showed their pain, how they showed their disease versus what we're seeing in their home. Totally different, just way more beneficial for the patient in how I approach them and how I manage, their discomfort or their disease.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode. Hey everyone, I am super excited to introduce our guest for today. We have Dr. Erin Dresner. She is a phenomenal human being, and she happens to be a diplomate of the American Board of Veterinary Practitioners in Feline Medicine and certified in Veterinary Medical Acupuncture. Her concierge house call practice, Bloom Integrative Veterinary Care, delivers the highest quality conventional medicine and evidence-based holistic care to loved pets and the occasional zoo animal in Northwest Houston, Texas. Above all, she is a full-time mom to her 5-year-old son, Wylie, and 21-month-old daughter, Lydia. Dr. Dresner and her family spend most of their free time exploring the great outdoors, playing in the mud, and tending to their native Texas gardens. So glad you're here. Welcome, Erin. I'm glad to have you.
Thanks, Eve. I'm excited to be here.
Fantastic. So I wanted to start off the episode with this question. What is your favorite snack to eat in the car?
Well, I mean, I'm usually doling out snacks to my kids in the back seat. So, eating in the car for myself is often a nice treat. But recently I've started implementing intermittent fasting into my routine. So when I'm driving now, I don't snack as much. I just noticed a lot more mental clarity. And so when I'm driving and serving kind of the Houston area, we drive a lot. We spend a lot of time in our cars. And it's just a really great time for me to collect my thoughts, think about what I want to do with my practice, think about my patients. So I always have something just in case. So usually I'll have a really nice, I like these Ben grass finished beef jerky things that I've been trying. Those are great. Sometimes I'll have a hard boiled egg on hand. But yeah, usually something with a lot of protein. Again, just help with my mental clarity or just getting through the day.
Totally, that makes a lot of sense. I've been doing a little bit of intermittent fasting for a while now too, but I usually do it in the morning. By the time I'm in the car, there has to be food in my mouth. But it's interesting. It sounds like you're also snacking on food for thought.
Well, I mean, no pun intended.
No, never. We won't do this here. But it's true, like, it's a really interesting thing that you said. I find that to be true too when I'm in the car. It's like my gears are literally turning in my brain too,
Yeah,
right? Like, ideas
yeah,
of the business, they come on the road, right? Like, is
they
it
do. And it's always during, like lots of traffic and I'm navigating and weaving and it's like, I need to write this down, but I can't. Maybe it's just a function of needing, like you come up with your best ideas when you're not able to write them down. And so I don't know.
that makes sense, actually. I mean, I could see, like, your brain is engaged in a different way than, like, sort of like that classic verbal, list making mode where
Yeah.
you're just, your brain is a little bit more relaxed because it's not under pressure to produce an idea.
Yeah, and there's a lot of muscle memory involved with driving and just rote, like navigating geographical landmarks. Like, yeah,
Yeah.
different parts of your brain are being activated. Makes total sense to me. Yeah.
It totally does, and, I mean, that actually reminds me, like, I sometimes will, like, turn on the I shouldn't be fiddling with my phone at all while driving, but, unfortunately, I do. I think we probably all do somewhat, but I'll turn on the voice memo thing, and I literally, like, make voice memo notes when I'm
Oh,
like,
yeah.
George, I've got it. I've figured out what to do with information else." Sometimes we'll actually, like, voice transcribe some things like that. I don't know, do you ever do that?
That's a great idea. I don't because I typically don't have the microphone on my phone because I worry about who's listening and, you know, I don't want ads for random things to pop up because they do ease their listening.
No, I mean, like, there's so much on our iPhones. Do you have an iPhone?
Oh, I do. Yeah, of course.
Yeah, I mean, there's so much. It's interesting, like, there's no other place some of these ads and information about us could have come from than from our actual use of the phone, right? Like,
Oh, yeah, yeah. But I like that idea. I'm gonna have to see if there's like a way that I can do that. I mean, and I don't want anybody stealing my ideas, so maybe I'll just keep to my pen and paper.
I hear you on that for sure. So, can you tell me a little bit about how you became a house call vet and, what your journey was like? You've got a unique house call practice for sure, and we'll delve into that a little bit too in just a bit.
Yeah, it's a little bit of an oddball, but it's okay because I'm an oddball. But
Nice.
so yeah, I was working super full time at a feline specialty practice, and the pandemic hit. And at that time, it just became apparent that the best place for me during that time was at home with my son for many reasons. Obviously, with schools changing and just the concern for this pandemic and how to keep my family safe, I just decided to stay at home with him. So I left clinical practice, which was tough because I was at that same practice. That's where I had finished my residency and my training. I'd been there for about 7 years practicing. So it was a tough time. But during that time, we also added our daughter. Yeah. And so
You added her.
I'm sorry.
You added her to the
I
family.
added her. Yes. Come on board.
Yeah.
Um, Being able to stay home with her full time after she was born, it marked a huge shift in my perspective about being a working mom. Because with my son, I only had 4 months after, which is actually longer than most moms get. But after that, how could I go back allowing someone else outside of my family, without my family's best interest in mind? How could I go back to allowing them to dictate when I could or couldn't spend time with my family? What weekends can I be available to my family? What time can I go home at the end of the day? Having that freedom to make those decisions for myself, I'll never go back to anything else.
Yeah.
So, yeah, it's very addicting.
Yeah. Yeah.
So, but during that period, I had several very tenacious and persistent previous clients who I had been, seeing their cats for years. I had been practicing acupuncture with their cats for years. And it was an abrupt end to their cats receiving those treatments. And they were noticing a decline. And so they were very tenacious. They found me despite my best attempts. I did all the things. I changed my social media names. I deleted accounts. I did everything I could to hide my visibility. But they found me And I wanted to help them because their cats were in pain. Their cats were declining in ways where they had seen so many great successes with their treatment. So I was still under a pretty restrictive non-compete as a specialist. So we had to get creative. Basically, we found places outside of that radius, one of them being my personal home.
Yeah.
Yeah. They would bring their pets to my house. And I continued their treatments. And it was a huge risk, obviously, inviting clients into my personal space, but it worked. And I'm so grateful for those clients for being so tenacious and being so just have to treat my cat. You have to. I can't, look at what she was doing before you left, and now she can barely move. And it really got me in the field. So yeah, I was doing that very loosely, and then it just evolved naturally. Once my daughter was about 18 months, I made it like a real thing, and I started word of mouth. I mean, I didn't advertise, it just word of mouth. People started finding out that I was offering integrative services, and it's just been a whirlwind. It's been wonderful. But that's how my practice was born.
That's amazing. That's one of the most, like, organic stories of how a person's house call I mean, a lot of us have similar ways, like, similar but not similar, but just such an organic way. Like, it started from a decision to prioritize your family, and it evolved from there, and that is actually a really, really common thing. A lot of people go towards house call practice intentionally. They make a shift, "I wanna spend more time parenting, being with my kids." And they make it really clear, like, line in the sand, like, "I will now become a house call vet," but it sounds for you is really, really organic, and it was almost like against your best efforts it happened, but so interesting.
Yeah, it was very organic, and I almost had a moment where I was like, "I don't wanna do this." There was a lot of working through, like, "Do I really wanna be a house vet?" I'd been so spoiled in the clinical setting with all the bells and whistles, and I thought, if at some point I do go back to work, maybe as a relief veterinarian where I'm still in charge of my schedule, but, has to be in the clinical setting, but no, it's been very organic, and I've been able to see my patients more organically in the house call setting. I mean, I see patients' behaviors that these are the same exact patients. Like, it's not like one cat versus another, one dog versus another. These are patients that I had the experience of seeing how they acted in the clinic, how they showed their pain, how they showed their disease versus what we're seeing in their home. Totally different, just way more beneficial for the patient in how I approach them and how I manage, their discomfort or their disease. Yeah.
Yeah, absolutely. And you have a really unique perspective having regularly seen these patients in the clinic and then in the home. And I've noticed on the whole, just generally speaking, all of my patients are much less stressed than all of the patients in the clinic, just as a cohort, right? But for you to have seen the individuals and the difference between those specific individuals, that's such an interesting and beneficial perspective that you have there. And I mean, it's just really cool, and, I love that you had that kind of comparative experience, and very brave of you to have patients in your home too, like,
Yeah, I owe it to that handful of clients that there was that trusting relationship. And it was scary at first, obviously. Um, my husband took a little pause, like, wait a second. You've always said, you need this boundary between work and home, and now they're coming into your home. But it was just the perfect mix of the right client, the right patient. Obviously, it's not feasible for every situation, but it was a risk. I took that risk and it worked out. Yeah.
it's amazing. And are you still doing that to some extent, or are you all traveling primarily to the animals?
So now the non-compete's gone, it's expired. So now I have the ability those patients in their home setting. But even when they were coming here, it was even though the clinic had a really great approach to low stress handling and it was feline only. So it's not like there were barking dogs or smells of dogs. And the staff had training and low stress handling. It's wonderful, really. But having them in my personal home, they're was even lower stress. And then they're obviously in their home, it's like no stress at all. So, but no, I'm not seeing patients in my home anymore. So I've reclaimed my space. Yeah.
But yeah, definitely as sort of an intermediate step, that's why not? I mean,
Yeah.
like you said, there were clients you felt good about and that you trusted and that obviously love you because they went out of their way to find you. And so that's great. I love that stepping stone that you had there. I've heard of one other person doing that. It's cool, but it's not common. Really cool. And so you're a really interesting guest on the show. I mean, for a variety of reasons, but what I'm kind of interested in at the moment is that you're a specialist and a house call vet and you focus on cats. Can you tell me a little bit about your journey as a feline specialist?
Or yeah. So I did an intern year at a specialty practice, standard medicine surgery internship for a year. And then from there, I transitioned into an ABVP feline residency. And so it's a 2-year residency, but similar training, similar, maybe not as stressful as your typical year residency, but there were things that, I had to publish, I had presentations, I had to take board exams. So after residency, I stayed on at the same private practice, the feline only clinic, and I stayed practicing there, and it was great. There was another board certified feline practitioner there. We had, other veterinarians with tons of feline experience. So I learned so much. I mean, anything you can do with a cat, we did. So, advanced ultrasonography. I got to take advanced echo and abdominal ultrasound courses, dentistry, advanced surgeries, really high quality internal medicine, laparoscopy. We're doing that. I mean, it's a really great place. It still is to this day. It's a wonderful clinic. So I was there for 7 years and saw all these cases. At some point, I think 2018, I really started wanting to add different ways to manage feline pain. That became kind of a pet project of mine, just managing pain for my patients. So I looked into becoming certified in medical acupuncture, took the cure course, and big fan of that, and looking at it from a scientific perspective and looking at it from an evidence-based perspective, just worked really well with how my brain works. So I did that and I brought that service to our clinic and offering those services, I just saw huge results in my patients. And most of all, the clients saw those huge results, those same results at home, and they were hooked and I was hooked. And it just really added to my practice and how I managed my feline cases. That's how I became a specialist. I did the ABVP residency and I'm very grateful for it.
Yeah, that's awesome. I have a question that's slightly off the script. People constantly are asking me, don't you miss the surgery? How do you do surgery? So, how do you handle that coming from a very procedurally oriented or maybe even surgical background in your previous place of work? Do you miss it? Do you refer now? How do you handle that kind of from a logistic and a almost like an emotional perspective?
Well, it's interesting that you brought up emotional perspective because it is very emotional when you have a very specific skill set and then all of a sudden you can't use it. No, that's a great question, and it's a great perspective. But for me, I went from somebody who didn't like surgery, in vet school, I was like, I don't like surgery. But then during internship and then residency and practicing, it became something that I was really interested in. So leaving that, yeah, it was tough, absolutely. But I've found other ways where I can still practice my surgical skills. So I'd still relieve. So I relieve at general practice. And I also relieve occasionally at an emergency clinic. It's pretty high volume. And that keeps that part of my brain alive and keeps that muscle memory going. But it's a good point. If I didn't have those opportunities to continue working that skill and using that skill, it would be a significant loss. Yeah, absolutely.
Yeah, for me, I was fairly damaged by surgery, so I don't miss it at all. But there is a piece of me that's like, wow, I had that skill, and I could probably jump into a surgery, but I'd feel very uncomfortable. And I think surgery is not generally something you want to do if you're not doing it somewhat routinely. Like you don't want to be rusty in surgery. um,
But I do think if it were important to me or to you or, either of us didn't have any other way, you get a truck and you bring it
Right.
into your practice, right? Like, no one says you can't do that, right?
Exactly. You're right. No, it's all about there is a skill that you enjoy and you want to add that to your practice as a hospital vet. There are ways to do it. Like you had a guest on your podcast, and I remember telling you, I thought that was just brilliant, where she was renting out a space, maybe just 1 or 2 days a week. And it was kind of a hybrid model. I thought that was brilliant. And maybe we'll do that someday. I don't know. So I don't like, you're right. I don't like I do. I obviously do. If I ever can take a cat with a stage 4 dental or, needs a surgery, I'm gonna recommend it. That's the best interest for that patient in that case. But you're right. I'm the one that wants to do it. And it's hard for me to let that go. And where I refer, obviously I've vetted them and I know that they're performing the highest standard of care. Yeah, you're right. It's definitely, you have to let go a little bit of those services that you're so accustomed to offering, for sure. But in other ways, though, I think doing more integrative practice, I refer for surgery a little bit less frequently for things like BLOs and backs, more in the canine side of things, less likely to surgery for those because I know many cases and the evidence is there. Integrative medicine can be what those patients need and can be safer than surgery. So it's a dichotomy there. There's some times where I'm like, oh, I wish I could do that surgery. And then other times where like, that patient doesn't need surgery and I can help it without surgery. Yeah.
Totally, totally, totally. Yeah, thank you for bringing up Dr. Veronica Bocanegra. She was the one who had
Yeah.
yeah, she was like 3rd or 4th episode, something like that early, early on. But yeah, that was a really unique and interesting solution to that kind of thing. And I'm sort of almost hearing like, maybe you're gonna get a truck. Maybe you're gonna
Oh,
get a
I'm
truck.
not. No,
Maybe you'll
I
rent some
don't do
space.
that.
You're like,
No.
him.
It's hard because, yeah, I have all these ideas and these big things. You're like, I could totally do that. But the goal was to keep things small and to keep things, so that I could have time for my family. So it's hard balancing that and not running off with all the great ideas.
Oh my god, absolutely, and that reminds me of that saying, if you're saying yes to something, you're saying no to something else, and you have to pick what that's going to be because we are finite humans. There's a finite amount of time in our lives, a finite amount of energy that we have, and granted, you can think with abundance and try and maximize that, but the reality is, if we literally try to do all the things, and I'm severely guilty of this, something will suffer, something's got to give. And
Oh,
so, I mean, I love that you have sort of like a bigger picture and a bigger goal. And that's just the decision tree that you've made. You've gone down that avenue to prioritize something that you put first. You did that
oh,
intentionally. You made that decision. And you can always change it, but you did that intentionally and you have priorities. That's good. It's good to have priorities. So we were just talking before we started recording about our tips and tricks, sharing, swapping stories with blocked cats. And I was just telling Erin how I personally haven't had a whole lot of truly blocked cats for a very long time because I managed them early. And, I have that rapport with my clients where I have access to the patient early in the process. And I am very comfortable with the medical management aspect of things. They usually don't get to the point of blockage. Kind of like you were saying, now that your brain is kind of working a little bit more in that integrative paradigm, you see where surgery may not be necessary or where a procedure may not be necessary. Sometimes it is, of course, right? Of course.
yeah, absolutely.
But sometimes it isn't. And so I'm just curious to pick your brain a little bit and hear a little bit more in that vein. Like, do you have a few favorite types of cases? And I want to hear like your little, special Aaronisms for how you handle them.
So we were talking about block toms, right? So, and of course, I mean, standard of care is to catheterize under anesthesia, remove the obstruction. But when you have that rapport with clients and when you choose the type of clients who are going to be more observant, who are like to know, like, oh, my cat acting strange and in and out of the litter box. Well, even they are so observant that they're like, "Oh, the urine spot, it was the size of a quarter today instead of a golf ball, and that's
Yeah.
weird." So those are the type of like cat people that I love because we can intervene perhaps a little earlier and instead of maybe something that starts off as a partial urethral obstruction, you know, doesn't turn into a complete urethral obstruction. But also in our house call space, I don't have the ability to just anesthetize and place a sterile urinary catheter and have all of the monitoring for at least 72 hours of hospitalization or fluids and all the things. So a lot of times in those cases, and this is an interesting kind of blend of my emergency work with house call. In the emergency realm, obviously, we have patients where we don't have the liberty to do standard of care. So we have to think about other ways outside the box on how to treat these patients. So I've really started relying a lot on the Ohio State's non-catheterization protocol, which the success rates, it published success rate is around 70%. And I would agree with that in my practice. That's a percentage that matches with what I'm seeing. But, and it's not right for every patient, obviously. If you have a patient where we have severe azotemia, hyperkalemia, some of those derangements that you are expecting to see, if that's there, or if the patient's obtunded, it's not a great option for them. But if you have a patient who you are suspecting a partial obstruction, if you give them AIDS and Buprenex and a really dark, quiet room with a litter box and give them time, fluid, right?
My favorite.
Once they're sedated, then try to manually inspect that penis. And, sometimes there will be a plug that you can just kind of manually remove or massage out. And hey, you've unblocked a cat in someone's home without a catheter. I've done that, and it's a really great feeling knowing I didn't have to create a lot of urethral trauma. I didn't have to anesthetize this patient and have to add all that additional stress. So that's a protocol that I've relied on. So as a feline specialist, I feel comfortable making that recommendation. Without obviously talking about the risks and if it's not the right plan for a specific patient. I think it's so important to individualize care. It's not just, oh, you have a black cat, let's have. Like it's, hey, how long have we been blocked? Is he producing any urine? Is there any amounts, like even just dribbles? What does the bladder feel like? Is it, I mean, obviously it's large, but is it very turgid? Is it still a little pliable? Can we potentially manually express it? These are all things that sometimes I think are thrown out the window in standard practice, because we just automatically block cat. Oh, this is what has to happen. Not always. So individualizing your care and I think being a house call that really allows you to do that. So that's one of my feline house call things.
That's awesome. Love it. Yeah, I mean, I feel like in the ER, the reflex is block cat, on block. And so many times, earlier on, I think in my house call practice, I would send people in to the clinic or to the ER. And, there was actually still urine coming out. So it was partial.
Right.
And then it was like, oh, and in the last, several years, I've learned when they're partial, you don't need typically, in my hands, you don't need to have a procedure. You don't need to hospitalize them. In some cases, you might have to. And in the ER, of course, I understand it's a liability to not. And, we talked a little bit previously about, of course, you document and you provide the
Yeah.
Plan A, B, C, and D, like you mentioned, so people have their options. But it's really interesting. I haven't really had an actual blocked cat for many years in my own practice. I've had
We get to them so much sooner.
Mhm.
We get to them so much faster. I wonder how many kitties, have a partial obstruction and the stress of bringing them into the clinic further constricts that urethra, further creates stress and clamps down that muscle and contributes to the obstruction. I often wonder that because I'll get called out for a cat that, oh, he's blocked, he's not urinating. I go and I give him some drugs nice and relaxed anyways because he's still at home. And we just flip him over and, oh, look, there's a plug. Let me just remove that. And now you can pee and it's wonderful and it's not an emergency anymore.
That's wonderful.
and go on about the day. And when we talk about hey, how to prevent this from happening.
Mhm,
But
mhm.
another tip that you can consider that I really like, if you do have one who you've done, the A's, you've done the massaging, you've done the expression, don't be afraid to do a decompressive cysto, like just one try, get a decompressive cysto. Don't be afraid. You can do that in a client's home. And then, do even a coccygeal block. That's something you can do in a client's home as well, where you give them that block and that will relax everything. So yeah, you have so many options. You don't necessarily have to rush to surgery for that procedure.
That's so interesting you mentioned the coccygeal block because I remember reading that article when I was in surgical. Yeah, I
Yeah.
remember that so well and being like, "Wow, that's really awesome." And it is very interesting. It's worth mentioning the decompressive cystos because it was very unpopular for a long time, but it's
Yeah.
like the tide is shifting a little bit. It's becoming more and more commonly used, and people are becoming less afraid. And it seems like the risk of actually lacerating the bladder or like having a necrotic bladder that, lacerates when you do a decompressive cysto seems I mean, I don't know. I haven't done postmortem
Yeah.
any of
Right. Right. I mean, it's never happened to me, knock on wood, and
them.
I've done I don't even know how many, but between myself and my colleagues in practice, it's just not a thing. They make it sound like, "Oh my gosh, you're going to, rupture this bladder," but it's never happened to me. I hope it never does, but I'm just gonna keep doing what I
Yeah.
know has worked for my patient. Yeah.
Yeah, and that's where the art of medicine comes into. It's not just
Right.
about, it's like it works in your experience. It's helped animals, probably saved lives as far as, all of us vets know that if you don't do the gold standard, sometimes the, next best step is the thing that saves the life. Maybe in some cases that's what it was that saved the life. I don't know, but it's legitimate for sure. And yeah, that's the art and science of it. Oh my god, I could pick your brain all day. Like, I love that you're I love it, and I'm all about pain management too, and so I think maybe we'll find a link to that article. That was such a good article, it blew my mind. So I'm so glad you
Oh,
mentioned
that's
that.
great. No, I
Mhm,
think it's a great article, and sometimes I'll place some acupuncture needles in those patients too, like just along the bladder line. There's
mhm.
so many things you do. Yeah.
Fantastic. So, shifting gears completely, 'cause I have to at some point. I know we could talk about this all day. I know your husband has a really interesting job, and he is overseas a lot of the time. So,
Right.
I happen to know that you're doing a lot of the day-to-day parenting in your family on your own while also running your business, is that right?
This is correct.
Can you tell me
My
the challenges you've faced as a mom and business owner in that capacity?
Yeah, so he works currently off the coast of Africa and Senegal. He works on a ship, and so he's working for 28 days, 2 days to travel home, and then he's home for 28 days. So our schedule and our lifestyle is a little different than most others. When he's home, the good news is that he is completely home. So he does take up quite a bit of the household duties. He's very hands-on with the kids. He's hands-on with meals. I mean, anything that I would typically do in the home, like he'll do it too. This wouldn't work without that happening. It just wouldn't, right? So, having him being so hands-on so that I can work on my business in his home, it's really just, just wonderful. And I think that's the only reason it works is because he is so supportive when he's home. The biggest challenge I think so far has been just boundaries with scheduling and when he's not home, when he's at work, navigating school schedules, especially when there are holidays or school breaks and I'm home with the kids, I can't necessarily keep my regular appointments, with my clients. So limiting those appointment slots, making sure I stick to those slots instead of feeling guilty if I can't squeeze patients in, then that works for me in my practice. When the kids are in school and everything is pretty smooth and nobody's sick, that's the other thing is when kids get sick, stay home. Just 2 appointments a day is kind of my sweet spot. It gives me enough time to give my patient the time that I like to give. I tend to have longer appointments because I develop, relationships with my clients and It's important for me that my clients understand exactly what their pet's diagnosis is, what our next steps are, why am I doing what I'm doing. That's one of the really important things about my practice and what makes me a little bit different. So having 2 appointments a day is ideal. Then I can get my records done and I can work on the business a little bit before I have to then go pick up my kids after school.
Hmm.
So working more when he's home, just making sure my boundaries with scheduling and not feeling guilty if I can't, you know, oh, and his client, I have a yoga class at this time. Well, yeah, that's really tough. I understand that's important. That's part of their work-life balance too. But I have to be very protective of my schedule as well, especially when my husband's home. And maybe I will squeeze that patient and when he is home and I have that ability. So it's very much kind of an ebb and flow. Another challenge has been just boundaries with the time that I need to work on my business versus time I need to manage the household. So one of the solutions I've really been working on, it's hard. Any mom will tell you it's hard accepting help and not feeling guilty. So obviously I'm very lucky to have family that are somewhat local who can help. My parents come at least once during the month that my husband's gone. They come for a weekend and they are very hands-on with kids and I can kind of get away and work on things. And then in the times where my parents or my husband's parents aren't available, feeling okay about hiring a babysitter, even if it's just for half a day, it's on a weekend, like a Sunday, and I want to attend the house call that, Zoom chat that morning, maybe I'll hire a babysitter just to come for half the day. I used to feel really guilty about that, but I'm learning to let that go a little bit. Hiring a housekeeper has been very, very beneficial to my mental health. So that way, when my husband's away for work, it's not just another chore that I have to do. That's been great. And then another solution, this is kind of a pro tip for the moms out there. Giving myself permission. I take 24 hours when my husband's home. I schedule a 24-hour mental break where I find an Airbnb, maybe a hotel room. It doesn't have to be expensive. I mean, you can find an Airbnb for $50 a night. Go camping. I don't know. Do something for 24 hours where you are outside of the household and do whatever you want. And most of the time, I use that time to work on my business. I like it because I'm working without, oh, look at that pile of laundry sitting over there that needs my attention, or oh, that those dishes, or oh, because they're fighting again. And my office, I can hear them and it's approaching on my space here that I'm trying to use to work. So I'm very productive those 24 hours and it gives me a break. And you're the sole caretaker for children. And you're almost, I don't want to say that I'm a single parent, but because I don't know what that's like, but it's very close to what I imagine a single parent would experience. Managing time to take for yourself is so important. And it's hard as moms to always make sure that you get that. That's important to me too. I think it's different when you are a stay-at-home mom and have the kids all day. You still have a counterpart coming home at some point. In most lifestyles, your husband works a 9 to 5 job and doesn't travel. At some point that evening, your partner will be coming home that, pick up the slack or help or even just to have that adult interaction. And when you don't have that, there's no space for that mental reset. So I think that's kind of challenging and just making sure that I get that has been really important to just my success and my productivity. Yeah.
Well, thank you for sharing that. There's so many things I kind of want to respond to. And I think, first of all, I wanted to start out by saying thank you for sharing that you experience that guilt because
Wow.
I know for a fact that vets are towards guilt.
Oh yeah.
And then you add the mom thing on top of it. And like, well, I guess I didn't say this, but I'm not the parent of a human physical child. So I don't have that experience, but I am, personally prone towards guilt and I know what that sensation is like and it's horrible. And, I'm just really glad that you're leaning into that and accepting help. And accepting that you can't help all the animals all the time and accept, sometimes you can't get that one patient in. And that, it's okay to take 24 hours just for yourself. Like, I just love that you're doing that. And I think you're an inspiration for, addressing that and sharing your struggle and ability to overcome that by making decisions to accept help and to take that time for yourself. So brava. And I'm just really
Oh, thank
glad to hear that. I think it's inspiring for a lot of people to hear. And there are a lot of folks who are parents and who look towards house call practice as a way to be with their families. But the other side of the coin is there's the guilt side, and there has to be an intentional plan for how to manage those two things. And it's obviously very doable. There's tons of people thriving who are actually single moms,
yeah,
like full on physically single moms and running successful, like, really satisfying and wonderful house call practices, and they're doing it. It
yeah.
just have to take care of yourself. You have to admit, when you need help and accept it. So it's great. And I love hearing that you hire you hire some when you come to our groups, the House Call Vet Academy group Zoom. That makes me so happy to hear.
I do because that's a priority to me. I love the Zoom calls. I learn a lot from them. And it's also just that connection with like minded individuals running their own business. And I consider that being able to attend that, I consider that self care. So, yeah, I'll hire a babysitter, come hang out with my kids. They're wonderful. They're lovely. They're so much fun. But right now, I want to do this. I want to participate in the call and learn. And so the 2 don't always mix.
Totally, totally. So, I mean, kind of on that note, I just wanted to say I'm really proud of you in your house call practice, and it's been really exciting watching you grow and your business develop, and just kind of watching you make these prioritizations and things like that in the academy, and having you as a part of the community has been just really, I think, valuable for everyone. And I wanted to, just seeing how well your practice is going, I wanted to ask, do you have any tips, couple tips for any newbie house call vets? You weren't a newbie when you joined, but a lot of folks who are thinking of becoming house call vets listen to this show. So I'd love to hear your perspective for them.
Well, I feel like I'm still a newbie in several regards. I think just because I kind of had these, moving when I joined the course, I would say that I still had a lot to learn. I still do today, have a lot to learn. But I think the biggest tip that have worked for me anyway, I invested, I think, the most in obviously the house called Vet Academy, which, for a business starting out was an investment, but it's one that I think has had a great return. So there's that. And then I invested a lot in my branding. I started out, I did have a logo that I had created on Fiverr, very inexpensive, and I liked it, but there was just something missing. It just didn't, I don't know, it just wasn't working for me. So I invested in branding with a professional marketing business. She is also a woman running her own business. And so she understood kind of what I was looking for. She did wonderful work. She my logo. She made my color palette, my branding. So one of the activities that she had me do was to think about my most ideal unicorn client, what that person looks like. What do they do? What are their hobbies? Obviously, cats has to be high on their list, but just think about that client and then design a brand around that. And I thought that was really a unique way to approach that. I really thought that was great. And she did a great job. And so investing in my branding, I would say, is one of the most important things because offering not just house call practice, but offering a specific niche within house call practice, offering integrative medicine. You have to make sure that you're showing people what you do. It's not so much, I'm just going to come in and fix your dog or fix your cat. It's, there's a way that I'm going to do it. And I have to tell you how I'm going to do that, why it works, and how I'm different than the other veterinarians or the other house call veterinarians. There are other house call vets in our area. So focusing on my marketing, my branding, and just making it so that when you go to the website and you look around, I've had people tell me that instantly they feel calm, instantly they feel relaxed, they feel almost like a rapport. I love that, and I love that she did all my branding, but just focusing on that and having that as the first impression that potential clients see, I think has really helped because before that, it was all just word of mouth, but people would always ask, "Website?" And I think having one where people feel that connection with me just through a screen sets the tone for the way that I practice. We're going to have a personal relationship. I'm going to be in your home. I'm going to be working with, your pet who is very likely your best friend and sees everything and knows everything about you. Feeling comfortable with me is so important. So, and making sure that my brand reflects that was very important. The other kind of tips I think would be, don't be afraid to fire your support. So like fire your first accountant, your second accountant, third accountant. Finally have an accountant
I've done that.
that I love. Yeah, right. Being a house call vet is such a small niche in and of itself, but then like, being a veterinarian by itself is already like very particular. But being a house call vet is even more particular. It is. And so
Yeah.
finding all those people that you need to find to support your business, making sure that they either have experience working with veterinarian or even better, a house call veterinarian, but also, if they don't have experience, that they're willing to learn, they're willing to invest the time to learn what makes you different. Yeah, so that's another tip. Don't be afraid to shop around and start with one and say, oh, this just isn't working. You don't really understand my business or what I want to do is what I offer. It's very, very unique, very individualized.
Sure
It's
is.
a very specific type of patient and a type of family. And it's not right for everybody. And I understand that. And so yeah, finding people who understood that and could still support that while they were supporting my business was tough. So finding the right fit there was important.
Yeah, I totally agree with that, and I've also been through multiple professionals, advisors, coaches, everything, and it's just like it took so long to find the right match of a person who would kind of understand and work with my vision, which is part of why I have the house called Vet Academy, because I was like, it is so hard to find someone who gets it, you know? And so I was like, all of these people that I talked to, and I finally found the help I needed. And there's a way to kind of get this into other people's realm without them having to kind of go through all of that. But you're absolutely right. If you find yourself with either an advisor or a professional of some sort that doesn't match for your needs, next, move it along. You're absolutely right. That's what you have to do as a business owner. And that doesn't come naturally to most of us. So when you become a business owner, knowing like, identifying quickly when something's not working and making that change is really, really important. So thank you for bringing up that point. It's an excellent point. I love that. I also wanted to thank you for kind of putting this bug in my ear a few months back about doing the House Call Vet Academy retreat. We did the very first one of that in October, and you gave me the idea for it. It was super fun and it went better than I imagined. I was a little bit nervous about it, but it was just like such a good experience for everyone. So like meaningful to be with everyone in real life and just really special just to connect with you. We got mani-pedis first before the retreat started. It was so cool. Can you tell me a little bit about your dream that you told me about that started this? I'm just really curious for people to hear, just the origin of that.
It was a dream, Eve. I fell asleep. I had a dream that I woke up and I said, wow, you have to make my dream true.
Yeah, so I remember
So
you
yeah,
telling me. Yeah, I remember you telling me you were thinking that we would, or you had this dream that we had a retreat in the house called Vet Academy so that we could work on our businesses, not just in our businesses, a little bit away from the craziness of daily life. And I was like, hey, girl, that's a great idea. We're going to do that.
yeah, I just had this dream where I remember it was like in a common area, like a house, and there were several vets there. You were there. And I think I had been watching your horse like right before bed. So maybe that's
Yeah.
why it triggers us. Yeah, I just remember feeling very like excited and energized to work on the business because it's tough for me specifically, like finding time and space to work. And that's part of why I take that 24 hours, But if we had a time and a space where there were several of us bouncing ideas off of each other, so you don't get that in our day-to-day practice because we're, solo most of the time. Just hearing other people's perspective. That's just kind of what I dreamt. And you absolutely made that dream come true. And it was totally like, there's nothing I would have changed about the retreat at all. But I felt great time to interact with each other. We had great time to work on our own stuff if we wanted to. It actually went above and beyond what I had dreamed because I had no idea, no expectation, right? Leading us through different exercises and workshops, kind of encouraging us with questions and having time to think about certain things and think about things in ways that maybe we hadn't asked ourselves. So that was even above and beyond. And then on top of that, you cooked for us, which was beyond my wildest dreams.
Aw. Well, thank you for also doing some of the cooking. That was absolutely valuable and awesome. I was like, "Oh, thank goodness. I have help."
It was fun. It was fun and it was so relaxed and genuine. I loved how genuine it was. I feel like all the women on the trip all had very similar shared experiences in our transition from clinical practice to working as a house call veterinarian. That was mind blowing. I think that was the biggest surprise was just how similar our stories were. And picking each other's brains with bouncing ideas off of each other is just wonderful.
Awesome. Yeah, it was so much fun. I was so thankful that you had that idea and that you were there. It was just great. It's just made my heart beat.
Oh.
So, in wrapping up, is there anything else that you'd like people to know about you before we close up shop here?
Well, I'm an ABPP mentor. So I have several prospective AB candidates who are working through certification at different points along their journey. And so most of the time, it's definitely recommended to have a mentor to help you through that process. So I'm happy to help. I would love to see another house call vet become certified. And it's just a way to elevate your practice so that you know that you're giving your patients the absolute best care. But yeah, if anybody is interested in mentorship or has questions, I'm happy to help.
Awesome. Thank you so much for that. And since we are in the House Call Vet Cafe podcast, can you tell me what is your favorite beverage?
I'm very boring. I drink a lot of water, a
Great.
lot. Yeah,
Great.
yeah. I do drink coffee as well. I made it all the way through adulthood, vet school without coffee. But then I had kids and now I drink coffee every day. But I do drink a lot of water as well.
Awesome. Well, you're a healthy person. You're doing the intermittent fasting and you're doing that's we should all take a page out of that book. Good for you. All right, Erin, thank you so much for your time and your wisdom. I'm just so excited we got you on the podcast. It's been a long time coming and thank you for all of your offerings and just thank you. You were great.
Well, thank you, Eve. I mean, you're just obviously the best. And we all have learned so much from you. And just glad that you are out there being so brave and putting out this content for us so that we can grow our practice.
Thank you so much. I'll talk to you soon.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for house call vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.
If you're looking for help with ultrasound scanning, check out First Opinion Veterinary Ultrasound for independent machine reviews and online and in-person teaching options. FOVU, simplifying ultrasound.